Cortez Masto.
Thank you, Mr. Chairman. Secretary, thank you for being here. I appreciate it. First of all, thank you. The incredible work that you and your team are doing around prescription drug negotiation as authorized by the Inflation Reduction Act is so important for seniors and so many across the country to lower drug prices. So thank you. I also recognize that Big Pharma is in court right now trying to challenge your authority under that legislation, which unfortunately is happening. In addition to the Inflation Reduction Act negotiation, we also imposed caps on out-of-pocket spending for seniors for the first time. And so how is the initial out-of-pocket cap, which was put in place just January of this year, it's just the initial, but benefiting seniors right now, and how might that change when the $2,000 cap is in full effect next year?
Senator, thank you for the question, and thank you for your work. I know Nevadans are able to keep a little extra money in their pocket because of the work that you and your colleagues have done to lower the cost of prescription drugs. Many Americans, especially those who are in Medicare and who are getting older, have very high costs for medication. They are perhaps suffering from cancer, maybe they are having kidney failure, but oftentimes their costs are extremely high. And while Medicare provides a lot of support and pays for a lot, out-of-pocket costs can be very high for some individuals. It can be in the tens of thousands of dollars. Today, this year, the catastrophic cost limit kicked in as a result of the president's lower cost prescription drug law, which means that no senior today for those catastrophic costs pays more than about $3,500 out of pocket. And next year, starting 2025, the most for those medications that any senior will pay out of pocket will be $2,000. That is a life-saving measure for many people.
And that's true, and I've heard from so many of my seniors. How do they become aware of it, though? Is your agency pushing information out so seniors are aware?
We're trying to get that information out, but a real quick story. I had a senior come up to me and say, I went back to my pharmacist because when I saw what they had charged me for my insulin, I felt guilty that they had undercharged me, so I went back to the pharmacist and said, you undercharged me. And the pharmacist said, no, that's the new price, $35. She was just up in the clouds because this is a senior on fixed income, had been paying, I think, $117 a month, $35. That's real money in her pocket.
Yeah, it makes a difference. It
Yes.
makes a difference to so many of my seniors as well. Let me jump to mental health. Every single one of Nevada's 17 counties is designated a health professional shortage area. Also known as HPSA, as you well know. All 17 counties are primary care shortage area, and 16 out of 17 Nevada counties are designated as mental health shortage areas. The president's budget proposes to extend the 10% incentive payment for physician services provided in shortage areas to include a broader range of clinicians and behavioral health practitioners. This committee has also passed a bipartisan package allowing more mental health providers to receive an increased bonus for practicing in shortage areas. Should this increase in shortage area bonus become law, providers across Nevada would see an increase in their Medicare reimbursement. My question to you is, many shortage areas lack a physician, but Nevadans may have access to a nurse practitioner or a clinical social worker. So has HHS evaluated how extending the range of clinicians eligible for the HPSA bonuses might impact our workforce challenges, particularly in our rural communities?
Great question, Senator, because you're right. We learned, especially as a result of COVID, that there are health professionals that may not be physicians who can do some of the work that right now they're prohibited from doing. So we're working with states because the licensing issue is at the state level. So for certain practitioners, nurse practitioner, for example, to do things beyond what is currently provided by state law, we have to have the states make amendments. And so we're working with them because COVID taught us that a lot of health professionals are ready to go. They just have to be freed from those constraints.
Well, I appreciate that, and it's one thing I know working in my state, and you as a former Attorney General recognize that at a federal level, there's only so much jurisdiction you have, and it does require either state or local community government partnership here when it comes to looking out for the best interest of our kids, or whether it comes to opening the door for access to more physicians or doctors or mental health clinicians coming into the state. There is a role for the states to play as well, and I appreciate that work that you and your staff are doing, that partnership. Thank you.
Thank you.
Thank my colleague. Senator Cassidy is next.
Hey,